Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors, and welcome today. Today, I would like to start by expressing my grave concern about criminals being released onto our streets. Recently, the California Department of Corrections issued a press release that indicated 8,000 inmates would be eligible for release by the end of August due to concerns over maximizing prison space in order to address the COVID-19 pandemic. I'm asking the state to please rescind this decision. Orange County will receive about 150 of these inmates and possibly more. While these inmates would have eventually been received by Orange County probation at the end of their prison terms, the acceleration of their release at one time potentially jeopardizes public safety and creates a difficult financial situation for the county, as additional related costs to taking on this unexpected influx of new probation cases will cause unnecessary strain for our probation department. As there have been discussions with the state about reimbursing counties for incurring these costs, that funding has not been provided to Orange County as of yet. There is also the real possibility that some of these individuals reoffend, putting unnecessary strain on the resources and personnel of the Sheriff's Department and local police departments. I am sensitive to the issue of ensuring everyone's personal safety inside of correctional facilities, including our correctional officers when it comes to COVID. But I am increasingly concerned about some of the decisions coming out of Sacramento and believe they aren't being given full consideration to the potential ramifications, particularly when it comes to the public safety of the citizens of Orange County. In the last week, we saw a convicted pedophile released from incarceration who was not required to register as a sex offender. We weren't even given a valid explanation. Recently, California experimented with $0 bail, which we saw was a complete failure and rescinded, but not before we saw glaring examples of people reoffending only to be let back into communities. And now thousands of inmates are being released. On top of all that, we are facing radical calls to defund and dismantle our police departments. In the midst of this once-in-a-lifetime pandemic, we should seek ways to alleviate the strain on our law enforcement, not complicate it. Now more than ever, they need our support. I am joined by Chief Probation Officer Steven Sandman, who will be addressing this issue in further detail. Next, I do have some positive news coming out of the county that I am excited to announce. Starting this Friday, July 24th, the Orange County Social Services Agency will be starting an online donation drive called Operation Santa Claus that will distribute gifts to children in Orange County who have suffered abandonment, neglect, abuse, and have been placed in foster care. Last year, over 41,000 gifts were given to children in need across Orange County. Given the long-lasting effects of the coronavirus crisis, children in Orange County are in need of our attention and care. These gifts are given year-round for birthdays and graduations. The donation drive will run from this Friday, July 24th, until August 7th. Please consider assisting children in need during this time. For more information about donating, please visit, this is a long one, ssa.ocgov.com/ssa_volunteer/Santa, or easily call 714-679-2438 or email operationsanaclaus@ssa.ocgov.com. In closing, I want to continue to remind the residents and visitors of Orange County to please wear a face covering when you are in public place and unable to properly social distance, as well as follow hygiene and social distancing guidance. Compliance with this guidance will help us get out of this crisis faster. We must also remember that as we protect public health by social distancing and wearing a mask, we need to allow people to go to work safely and responsibly so they can pay their bills and feed their families. Today, I'm joined by Dr. Clayton Chow, Director of Orange County Healthcare Agency, and the Acting County Health Officer, who will provide an update on the county's COVID-19 numbers, as well as the county's response and mitigation efforts to this outbreak. I'm also joined by Chief Probation Officer Steve Sandman, who will be addressing the release of inmates being received by the Orange County Department of Probation. So I'm going to ask Dr. Clayton Chow to come up.
Thank you, Chairwoman Steele. Good afternoon. I'm Dr. Clayton Chow, Orange County Healthcare Agency Director and Acting County Health Officer. I would like to start by providing an update on the cases reported to us today. It's important to note that the California Department of Public Health has indicated on their website that due to changes in the source data reporting process, metrics related to hospitalizations and healthcare capacity are frozen as of yesterday. They are working to review the processes that generate these metrics. Orange County's accumulative case count increased by 905 cases, give us a cumulative total of 32,648 cases. I'm also very sorry to share that 22 deaths were also reported. Our hearts go out to the families and friends experiencing these losses. Please remember that you have the power to help slow the spread of COVID-19 in our community. As the chairwoman mentioned earlier, practice physical distancing, wear a face covering, and wash your hands frequently. Learn more at ochealthinfo.com/slow the spread. Now I would like to provide the community with an update related to contact tracing here in Orange County. The Orange County Healthcare Agency Public Health Department currently has approximately 185 staff dedicated to COVID-19 response, including case and contact investigation. Public Health Services trained 568 public health staff on contact and case and contact investigation, but the majority need to remain in their current capacities to ensure that we continue other public health programs and services. To further expand these services, we recently received approval from the California Department of Public Health to contract out for these services. The healthcare agency procurement team issued an informal request for information to several vendors that expressed interest in providing these services, and as a result, HCA selected Trace, T-R-A-C-E. Trace currently provides contact tracings and conducts case investigation work in Maryland, and we anticipate they will begin work in Orange County as early as next week. They will function as an extension of the HCA case and contact tracing investigation team and will add 33 additional CCI staff initially with the possibility of scaling up as needed. We also want residents to understand that you do have an important part to play in contact tracing. UCI Public Health is partnering with us and the Orange County Health Equity COVID-19 Community Academic Partnership to offer a health equity contact tracing workshop. The workshop trains public health practitioners, students, community leaders, and residents to do contact tracing for COVID-19. The workshop is designed with a fundamental focus on health equity. It integrates community knowledge about the impact of the pandemic on and the pandemic mitigation strategies for low-income communities of color with established models of manual contact tracing and presents the latest knowledge about COVID-19 spread and mitigation. The workshop is a series and will be delivered through popular education methods in a hybrid format of online content, live online group-based discussions, and role-playing sessions. The workshop is available free to the public and runs through August 21st, 2020. Please visit us on social media for more information. I would also like to discuss last Friday's update from the governor, during which he made announcements regarding schools, distant learning, and a waiver process for both public and private schools that would allow them to reopen in-person instruction for elementary school in the fall. The California Department of Public Health has advised us that the state is still working on developing the waiver process and an application template. Once it has been finalized, we will ensure all school districts are aware of the steps to submit. We will work closely with the Orange County Department of Education as well as posting the process on our website, so be on the lookout for that. So, it will be available for the elementary school in our community that are interested in doing so. In the meantime, if the community members have questions, please continue to call the COVID hotline at 714-834-2000. Let me repeat that number again. It's 714-834-2000. And now I would like to invite Chief Probation Officer Steve Semin up to speak. Chief?
Good afternoon. Thank you, Dr. Chow, and thank you, Chairwoman Still. My name is Steve Setman. I'm the Chief Probation Officer for the County of Orange. On July 10th, 2020, the California Department of Corrections and Rehabilitation implemented additional actions to maximize prison space in order to address the COVID-19 pandemic. The California Department of Corrections has reduced its prison population by approximately 10,000 inmates since the beginning of the pandemic. This next step in addressing the pandemic would make additional 8,000 inmates eligible for accelerated release by the end of August. Under CDCR's authority to release inmates due to the existing imminent emergency, they have created 3 cohorts of inmates that are eligible for release. The first cohort of inmates are individuals who have served 180 days or less to serve on their commitment. They are not currently serving a commitment for domestic violence or violent crimes and have no current or prior sentences that require them to register as a sex offender. The second cohort of inmates are those that have served 365 days or less and to serve on their commitment and have met the previous eligibility standards and are currently housed in prisons of high-risk populations. The third cohort are individuals of 30 years of age or older and meet the previously stated eligibility criteria. Additionally, inmates being considered for release are the high-risk medical cases, as well as cases that have participated in positive programming. The impact to the County of Orange, as well as the Orange County Probation Department, is that the expected approximate releases of, as of yesterday at 12 p.m., 176 additional inmates. CDCR has not yet provided us with a full accelerated release list that would include those being released with 365 days early. Those numbers are unknown at this time. These cases are in addition to the ongoing post-release community supervision releases of approximately 70 cases per month. Currently, the Orange County Probation Department supervises approximately 2,100 previously released commitments from state prison. The Probation Department has had to rely on existed limited resources, previously allocated staffing, and realignment funding to provide the release coordination, transportation, and supervision of these releases. Additionally, some of these releases have been exposed to COVID-19 and may in fact be positive for COVID-19. The Probation Department is working closely with the Orange County Healthcare Agency to manage any public health concerns. Thank you.
Thank you, Chief. Operator, we are now ready to start questions at this time. Do we have our first caller?
Thank you so much. First, we turn to the line of Tony Cabrera with ABC7. Please go ahead. Your line is open.
My question is in regards to some headlines that we've been seeing recently. One saying Orange County, California's anti-mask hotspot, sees coronavirus cases spike. Another saying is Orange County the Florida of California when it comes to downplaying COVID-19. With headlines like this, where do you think the county is in regards to the truth behind these headlines, and what can the county be doing to reverse it, maybe?
I'll go ahead and answer, Dr. Chow answer that question. Thank you.
Thank you, Tony, for that question. I think it's been very evident that the board, as well as healthcare agency, in every opportunity that we have, we've been encouraging the community to really comply to the order of face covering. As you could see, we have a lot of effort that are in the community right now in sending that message out. I think last week we talked about the fact that we have created postcard size that have messages on face covering and social distancing and hygiene practices that we will be giving out massively in our community. In our weekly call that CEO Frank Kim and I have with the mayors, we also encourage the local authorities to support us in sending that message of education out. So hopefully the citizen will realize the importance of it and comply with the order. So that's what we are trying to do. As you know, there has been ads that the CDC put out and the state put out in encouraging citizens to wear a face covering when they are outside and they're not able to keep 6 feet distancing. So I think that's the best that we could do, and hopefully the community will realize that together, in order for us to be able to drive the number down so we can reopen some of the business sector that has been dimmed, everybody have to do your part. And I hope people realize that you're inactive in terms of your decision not to participate cost the community dearly. As you see, the number go up, we'll shut down businesses. And in the end, we all get hurt together. So I'm pleading, and I'm hoping that you all would help us, pleading to the community that they really, really have to follow this. We need to drive the number down. So thank you for that question. Next question, please, operator.
Thank you. Next, we turn to the line of Brandon Ofo with Voice of OC. Please go ahead.
Thank you for taking my questions. It's Fo. My question regards county employees. So has the county either this or last month seen outbreaks or a rise in cases among county office employees at its different sectors, such as but not limited to social services, registrar of voters, clerk recorder's office, and exactly how many county employees in charge of providing or facilitating public services have been hit by the virus? And if you don't have that number now, then can we get it at some point? Thank you.
Yeah, Brendan, please contact us and we'll get that number to you. Thank you, Brendan. Next question, please, operator.
Next, we turn to the line of Paul Anderson with City News Service. Please go ahead.
Dr. Chow, how can the school get a waiver if the positivity rate is at where it's at? How do you ever get down below to that state threshold of the positivity rate?
Thank you for that question, Paul. So the waiver process is for elementary school only. So I want to repeat that because there seems to be some misunderstanding that it's for all schools. It's only for the elementary school level. What we'll do is each of the school will have to discuss with their labor union if they are public school, and then they also have to have a discussion with the parents. And then for some school where children and family are utilizing a community-based organization, the services from the community-based organization around the school would need to also have a conversation with those community-based organizations. And then the school would need to have a letter from a representative of each of the entities that I mentioned earlier. And then they will put together an application. And as I mentioned earlier, the application is due to be released any day now by the state. Then they'll have a conversation with the healthcare agency, and then we will look at the epi data around children. And so I think I mentioned it last week. If I have not, I'm going to announce it now. Currently on our website, if you look at our dashboard, we are reporting confirmed cases, and we group them by age group, 0 to 17, 18 to 24, 25 to 35, to 34, 35, etc. We made a decision now because of this important decision that schools and parents and teachers and school staff have to make. We made a decision that we will break down that age group into 0 to 3, 4 to 9, 10 to 12, 13 to 14, and then 15 to 18. So if you notice, I've been out of school for quite some time now. If you notice, that age group is breaking down to elementary school, junior high school, and high school. Now, some of you might ask, but why 4 to 9 and then 10 to 12? The reason why we also further break down that group of elementary students to 4 to 9 was because if you notice that this last weekend there was a lot of news about the study that published by South Korea on the number of people where they track, and they look at the infection rate. There was about 60,000 individuals in South Korea that they follow, I think sometime between the month of February to late March, and they were able to predict the transmission rate. And they talk about how when they compare children and adults, it looks as though kid the age of 10 and above, their transmission pattern is similar to adults. While at kids the age of 9 and below, it seems like the transmission between child to child and child to adults is much less. And so that was my reason, and perhaps it's probably safer when we talk about reopening in phase, and the first phase would be kid at the age of 4 to 9. So that was our reasoning. So we will create dashboard that would inform the community in the school of the breakdown of the cases, confirmed cases, with those ages group, and we will present it by zip code, and we also will be presenting it by city. So then the school and the parents will be able to look at your own city or your own zip code and then make a decision, right? Because you've heard me talk about this before. This reopening cannot be just a one-size-fits-all, because we don't live in the same community, even in Orange County. As you're aware, there are city and zip codes that are much harder hit than other zip codes and city. So that's what we want to do, is we want our decision to be informed by location, so then we can make really intelligent and decision on what we do as is related to putting our community as a whole at risk, right? Remember, when we talk about kids, we're not just talking about school in a bubble. We're talking about kids who will be exposing the teacher and the staff, especially those who are at the high-risk population. So we have to be really careful in seeing this as a community decision. And so we have had discussion with, at least on the public side, with all the superintendent of the public school districts, as well as Orange County Department of Education. And we will be working side by side with the school district, with OCDE, to assist individual school to make this kind of decision. So more to come. Thank you. Operator, next question, please.
Operator? Operator, next question, please.
We have some, apologize, we have some technical difficulty. Would you please hold on for a second?
Your call cannot be completed.
Please hold. A specialist will be with you momentarily.
Yeah, thanks for taking our question. Mine is for Dr. Chow. It's about long-term care facilities and skilled nursing facilities. The healthcare agency staff just told me that, you know, hospital patients, COVID patients are being transferred to those facilities, yet the HCA or the state's not keeping a direct number on the capacity or how many people have been transferred from hospitals to these facilities. And I was just wondering, you know, what the line of thinking is on that, and also at what capacity is the facilities are right now? Are they like in the same boat as hospitals in terms of maybe having to enact some kind of surge plans, or are they holding steady?
So yeah, so usually out of the So this is off pandemic time. Usually what would happen is a patient get into an acute hospital, and for some reason the next level of care that they need is skilled nursing facility. Then the hospital, as well as the family and the insurance company, will try and find a skilled nursing facility that is appropriate to place people. As far as I know, I've not heard of any a search for any skilled nursing facility. But Spencer, please send me an email or Molly an email. We'll look into it. I'm not her staff reporting that we have an issue yet, but we'll look into it. Thanks, Spencer. Operator, next question, please.
Thank you, sir. Next, we turn to the line of Ian Wheeler with Orange County Register. Please go ahead.
Thank you, Dr. Chow. I wanted to address what seems to be a slowdown, and if not a reversal in the rise of testing, the PCR testing for COVID-19 appears to have slowed down over the past couple of weeks. And one example, and I'm just wondering what might, if that is true, and what might causes of that be. One example I have is in the week ending July 1st, there were about 46,000 tests done in that 7-day period, and that had dropped to about 38,000 tests in the same 7-day period ending July 15th. So I wanted to know if that was something that your office has been detecting also, and what possible causes for that.
Yeah, thank you, Ian. Actually, I was looking at that right before we came to the meeting. I don't have the answer yet, but I can tell you, as you all know, last Wednesday we started our drive-through super site testing at the Anaheim Convention Center, and I can tell you the first 2 days, the soft opening on Wednesday and Thursday, the capacity was about 250 a day, and then on Friday it was 400, and then Saturday and Sunday it was 500. And I can tell you the appointment was booked solid all 5 days, and our no-show rate was only 4%, which is impressive. And so I don't know what the slowdown is. The demand seems to be there still. And if you look at the other site, people who want it to be tested, there's still a wait for the appointment. And then some lab, the result come back is also long. I think that this might be a CalReady, the reporting issue, that lab is probably get bombarded and not have enough time to input all the tests. Yeah, I'm interested to find out what happened, Ian, because clearly at the site that we have, there's no site that has an empty appointment as far as I could tell. So yeah, it's interesting that we were looking at the same thing. Thanks, Ian. Operator, next question, please.
Thank you, sir. Next, we turn to the line of Ian Lovett with the Wall Street Journal. Please go ahead.
Questions for Dr. Chow. Also, I'm wondering if you can go into some detail about what, through your contact tracing efforts, you're finding is driving the spread of the coronavirus in the county, and whether the measures taken so far in the last few weeks, like closing bars, have had any effect that you've been able to observe yet.
Thank you for that question, Ian. I think everybody is very curious on, hey, where did people get infected? And it's really difficult now that people are, lack of a better word, integrated back into the community, have been integrating back into the community, and a person could have multiple activities that put them at risk. So it's quite difficult. Even the person themselves would not know, well, I was at the bar, I was at the beach, I was here, I was there, where did I get infected? It's a very difficult question to decipher, right? And all case investigator and tracer do their best to try to ask people, where were you at? And so we can pinpoint, but as far as I know, we can't really pinpoint, but we do see the pattern of positive that kind of occur after each event, right? And so when we had the Memorial Day weekend, 2 weeks later, we kind of have a spike. When we reopen the economy a bit on the 19th of June, I think that was 17th of June or 19th of June, I don't remember. Seems like a long time ago. And then 2 weeks later, we saw a spike, right? And so over July 4 weekend, even though we dim a little bit, we did see a spike. So it's very hard to pinpoint what was the cause of the rise. I can tell you that transmission is in the community now. So everywhere you go, you're at risk. And that's the only answer that I could give you. And I think my colleague at other jurisdiction also see the same thing, is that people are just everywhere. So it's very hard to really pinpoint one activity that caused the infection. But it's a great question. I'm curious as well. Thank you. Operator, next question. I think this is the last question, right, Molly? 2 more questions. Operator?
Okay. Thank you, sir. Next, we turn to the line of Matthew Leslie with Fullerton Observer. Please go ahead.
Yes, thank you. Dr. Chow,
yes, sir.
Are you working with daycare facilities in the county at all to provide critical personal protection and things like hand sanitizer, face coverings? Is that a priority for the county? Are you, is that something where you're trying to see people who work there to make sure that they're safe and not transmitting it from children or catching it from children?
So that's a great question, Matthew. On the list of our given out or supporting entity with personal protective equipment, the daycare is not on our list of priority. Our list of priority are, of course, hospital, skilled nursing facility, congregate living, a jail, etc. I know we have encouraged businesses to contact their individual city where they locate to ask city for support with PPE. With the school reopening, perhaps that is the area that we will look into, because with kids coming back to school and then parents who go to work and younger kids might need to have daycare, and so probably that's where we would have to look into and provide support as well. But thank you for your question, Matthew. Operator, next question, please.
And our next question comes to the line of Emily Valdez with KNX 1070 News Radio. Please go ahead.
Hi, thank you so much for taking my questions. I want to talk about testing. So if you could first run down the numbers of public testing that you would do average on a day. And as you mentioned that all the slots were filled during the last, at the convention center, I believe. What are you doing to ramp up testing? What are your goals and what's in the future? Because clearly right now, not everybody who wants a test can get one. And also knowing that COVID-19 disproportionately affects people in underserved communities, what are your plans to get testing to those communities?
So thank you for your question. I'm going to answer your second part first because, in fact, I don't know if you are aware, it's been almost a month now, right, Molly? Orange County, we work with our community-based organizations, school district, city, particularly the 2 cities, Anaheim and Santa Ana, where we have the highest cases, especially in 8 zip code. We initiated a initiative called Latino Health Equity Initiative, because those are the demographic that we see in those 2 cities. And what that initiative does is work together with community organization, and particularly the lead organization in Latino Health Access. And what we've been doing is going into the community, provide testing in the community. In fact, there's been testing at school. We take the organization bring out a mobile testing unit in school every week, at least twice a week, and they're planned on every day coming up in about a couple weeks or so. Test people, educate people about what it means when you test it negative, what does it mean when you test positive, what does it mean when you're exposed, and what you need to do. And then also assess them for human health services need, all the social determinant of health that we talk about, and then link them to services. We even simultaneously stood up motel to be able to support family where there is no mean for them to go to a separate place should they need to be isolated or should they need to be quarantined. So I'll be happy to share that program with you and connect you with the leaders in that collaborative to have more questions. But that's what we're doing. As far as ramping up testing for the general public, we are following, of course, the state CDPH guideline as of to who we should be testing. As you know, the testing limitation is now a statewide, if not nationwide, issue. And so we're always following the California Department of Public Health guideline as to who do you test first. So briefly, people who are symptomatic, of course, and then symptomatic and asymptomatic first responder, people, essential health worker. But you notice even that the state is now tiering people, right? Just because of that limitation. In Orange County, I talk about us trying to ramp up the access for those folks who are in the top tier who need services. So we stood up the testing site at the drive-through in Anaheim. And there's plan to stand up another site in a couple weeks or so. Same concept, drive-through, etc. So be on the lookout. We always work to make sure that we have access for those who need to be tested. So thank you for your question. I think that's it. Thank you, everyone, for your time. And until next week, be safe, be well, and remember, wear a face covering when you can't stay 6 feet apart. And then if you are sick and you're a vulnerable population, stay home and then practice hygiene. Thank you for doing your part to ensure that our community is safe. And the lower the number, the quicker we get to the lower number, the faster we can reopen our economy again. So all of us are affected and all of us can do our share. Thank you so much.